Hello everyone and welcome back to my channel. Today I thought I'd go over COVID-19 and how it's impacting my life and my family's life and some of the things that we can do to help limit the spread and do our part to help spread out that information. So to start with, I'm fine. My wife is fine. As some of you know, my wife is pregnant. She's fine. My daughter's doing absolutely wonderful. My wife is very, very nervous, of course. She's definitely postponing many different appointments at the hospital. Um, we are nervous about contracting it. Where I live, I'm in Canada, and I live in Ontario. Um, so we've had approximately so far to date, when I upload this video, March 17th, we've had about 140-ish cases, up to about 180 cases. The numbers change all the time. Um, so, we're starting to see that ramping up, right? That exponential infection phase. And, it's definitely been very scary. And for those of you that have been watching, Canada has ramped up its procedures to try to help limit the spread of the virus. We've closed the borders to the vast majority of countries, except for places like the United States. So we still have open borders with the US at this time. Even before then, we were limiting the amount of travel. So we had travel advisories, then travel bans, to help limit the spread of people who were arriving from countries that had very high numbers of people infected with COVID-19. Now, where I live, we've been pretty fortunate. We haven't had a lot of people contract the illness. I believe at this time there's about 2 people. There's obviously a couple of others of interest who might have COVID-19, but we've been pretty lucky. However, I work at a university, and I'm a scientist, and I'm also seeing the ramifications of this panic and the various preparedness that our government and the universities have put forward. So what we've done at my university is we've began to slowly transition people into doing online classes, and now it's mandatory. So we said all students in undergraduate levels had to have their courses online. That put obviously a lot of burden on instructors, so people like myself and my co-instructors and that are all working hard to make that a reality. Obviously exams are going to be challenging. We're going to have a lot of changes with exams, so we don't have those large numbers, because some of these first year, especially in first year, second year classes, in my department, thousands of students, and just taking first year bio, for example, and we cannot have that many people in a room taking an exam. Or even showing up for class. We just can't have that. It's too risky. So I'm glad they're doing that to help limit the spread. Then, as more cases have developed, the university has gone from no teaching and everything online to now all grad courses are online, and also we're limiting graduate school proposals and doing thesis defenses and so on to postpone them all. So in some cases that's good news for some. It gives you more time to prepare for these things. But for others, like I have a colleague in our lab who has a job lined up, a PhD lined up in Toronto, the University of Toronto, and she has to wait and postpone that defense until this is over. Seminars have been canceled. So it's been very interesting from that point of view. And then as of today, I was told that all research, non-essential research, is canceled. So that's including mine. I mean, I work on plants and climate change, so not essential. And so I'm off now doing that, working from home. And I've been working from home for almost a week now, sort of distancing myself. with that. And it has been tough. And it's starting to get more and more difficult. Here in Ontario, we have declared a provincial emergency, or a state of emergency for this COVID-19. We're doing everything we can to limit that spread. They've closed restaurants, so no sitting down, public sit downs. It's all takeout, or you walk into a Starbucks or a Tim Hortons, grab your coffee and get out. You're not sitting around in the restaurant anymore. Bars have closed. All parades have been canceled. Any type of museum or daycare, schools, obviously, from pre-K right up until high school, all canceled. Some cases till further notice. Many elementary schools and high schools have been canceled start back up in April. So, and it's possible that they could be extended depending on how this goes. And that's sort of where I want to talk about now is where this can go. And I'm not an epidemiologist. I'm not a physician. I'm not a medical doctor, right? Any kind of specialist there, right? I study plants. I'm a plant physiologist and cell biologist or biochemist. That's what I study. But I do have some scientific training in generalized science. And so when we are hearing these types of ideas like social distancing, meaning you refrain from having big gatherings, you keep at least 2 meters or 6 feet from the next person, giving that space so that you don't get infected. I think that's very important. The other is that social etiquette, right? Many of your parents, when you were kids, right? I remember when I was a kid, my mom and grandma used to get after me all the time. When you sneeze into the crook of your arm, right? You don't sneeze all over. If you cough into your elbow or into a tissue and throw it out. A big one is washing your hands, right? There's been a lot of research now looking into what is the best methods for these things. It's been shown that doing 20 seconds with just soap and water is exceedingly effective, very effective, right? There was a study that was done, I forget now what paper it was in, but where they showed that even the action, like the mechanical movement and rubbing of your hands under the running water, was pretty effective in and of itself, even if there wasn't any soap. Of course, there are people who are going to use alcohol-based hand sanitizers. Make sure it's at least 70%. I know as someone who works with fungus and before bacteria, when we wanted to make sure things were sterile, we use a 70% ethanol solution. So make sure that you are using at least a 70% alcohol-based hand sanitizer. To disinfect your house, obviously, a 30% solution of bleach to disinfect surfaces, or there are certain types of Lysol wipes and Lysol sprays that you can put on to help sort of disinfect. I think just being a general proper etiquette, right, when you're out in public is going to be helpful. The other is limiting your exposure to outside and to protect our most vulnerable, people who are the elderly, which if you look at the statistics, they're that make up the bulk of the people who are unfortunately passing away from this virus. Protect them. Stay home. Don't visit your loved ones. I know it's tough to not see people who you're worried about, but we have phones. Call them. Check in that way. Check in on your neighbors, right? I think overall, we need to definitely do these various measures. Stay away from people. Don't go outside unless it's necessary. If you can work from home, work from home. That's what I've been doing. Yeah, it's tough. Yes, there are sacrifices. Yes, there are, times where you do want to go out, but you have to limit it, right? And try to be responsible with it. And I think a lot of this is just being being responsible and just ordinary, being a decent human being in most cases. The other thing that I want to talk about is this idea of hoarding stuff. You know, people are always afraid of running out of things. I mean, you have to just buy, and hoard. It that's not very effective, because what ends up happening is we make scarcities at times, not always, but we can. We can buy large amounts of a particular product. For example, recently it's been toilet paper. Still not sure why that's the thing we all go for, but toilet paper. But then the people who need toilet paper, who just happen to run out ordinarily, don't have it. And now that's a problem. And I think we just have to think about stuff like that. Be reasonable, share, have that altruism. And by doing all these things, staying away from others, not, going out unnecessarily, sharing, we can help flatten that curve. You hear that a lot. Oh, we're going to flatten the curve. And all that is that we're trying to, over a longer period of time, keep the spread of the virus from going too quickly and overwhelming our healthcare system, right? So if you have only so many number of beds, so much amount of space, and so many ventilators, and so many doctors and things, there's a certain capacity that a hospital and the healthcare systems in each country can handle. What we want to do is, if we just let everybody do what they wanted and go out and have all these mass gatherings and so on, that spread of the virus can shoot up really quickly and then surpass the carrying capacity of our healthcare system. And then you get an overburdening amount. And we're seeing things like that in Italy, where they're in some parts, it's so burdened that people are dying, right? Doctors are having to decide who lives and who doesn't. You don't want that. So by sort of flattening the curve, making it go from this huge peak to a more broader peak over a longer period of time, it allows the healthcare system to work more efficiently and get more people the help they need when they need it. The other thing is know the symptoms of COVID, right? There's a lot of people I know here in Canada. At our local, we have many different hospitals in our city, and people are going there for useless things. Like they have their eye is sore or a headache, and they're running to the hospital, thinking they have COVID-19, and they're just completely flooding these places. Don't do that, right? Know the symptoms, right? COVID-19 main symptoms are fevers, right? If you have a fever, you're having difficulty breathing, that's when you go to the hospital and call your doctor. For the vast majority of us, from young children, which they found to be quite immune, quite resilient actually to the virus, all the way up to people, younger than 50-ish thereabout, you'll get mild symptoms. The vast majority of us will get mild symptoms, like an ordinary cold or flu-like symptoms. It's the elderly and people who are immunocompromised, or people who have some type of pre-existing condition like diabetes that might be more likely to have more complications from this virus. So we need to be patient. We need to sacrifice some of our liberties and freedoms, and so that we can limit the spread, protect our most vulnerable populations. So we all can get through this together. And it's tough. But I know and I believe in humanity, that we will be able to get through this. And I believe that my country and all other countries in the world can band together to fight this. And hopefully we'll all become stronger from it and learn a little bit about how we might think we are the most dominant and most powerful species on the planet. But a simple virus can wreak havoc and ruin that high clout that we believe we have. So just think about that. And I'm hoping some of the stuff that you'll take seriously and practice it. So with that, I want to thank you all, and stay safe, stay healthy, and above all else, just enjoy life, enjoy being at home. Take this opportunity, play some games you haven't played in a while, spend some time with your family at home, watch Netflix, binge some sort of TV show, just enjoy. So with that, I thank you all for watching and have a great day.